Perhaps the best example of social benefit bias and its close relationship to idealization bias is Moore versus Regents of the University of California, a case involving surreptitious research. Mr. Moore had a rare and deadly cancer known as hairy cell leukemia in his spleen. He sought treatment from Dr. David Gold, a prominent cancer specialist at the UCLA Medical Center. He gave Dr. Gold permission to conduct a splenectomy, the surgical removal of his spleen, to treat his leukemia. After the successful procedure, Moore moved to Seattle. When Dr. Gold asked Moore to return for follow-up treatments, Moore was not suspicious. For the next 7 years, Moore dutifully flew from Seattle to California every few months and underwent sometimes painful medical procedures that included withdrawing samples of blood, skin, bone marrow aspirate, and sperm. He made the trek because Dr. Gold asserted that the procedures were medically necessary and that only he could perform them. Neither assertion was true. What Moore did not know was that prior to his surgery, Dr. Gold had developed research and financial interest in Moore's cells. The procedures Dr. Gold performed after the successful surgery had nothing to do with treating Moore's leukemia, which was in remission. Instead, Dr. Gold was actively conducting research on Moore's cells solely for financial gain and commercial advantage. Dr. Gold exploited the doctor-patient relationship to ensure that he had exclusive access to Moore's cells. When Moore specifically asked Dr. Gold whether there was any possible research interest or financial benefit in his bodily substances, Dr. Gold repeatedly told him no and actively discouraged any such inquiries. In fact, Dr. Gold went so far as to say that there was no commercial or financial value in Moore's tissues. Dr. Gold never asked Moore for express consent to the removal of his blood and tissue. However, at the close of 7 years, Dr. Gold asked him to sign a consent form giving UCLA permission to use the withdrawn tissue for research purposes. Dr. Gold presented the consent form as a mere formality and Moore signed. However, Moore became suspicious when, after he later declined to sign a similar consent form, Dr. Gold offered to pay for his airfare and accommodations at a ritzy Beverly Hills hotel. Moore hired a lawyer. During his investigation, the lawyer discovered that Dr. Gold had obtained a patent on the cell line developed from Moore's cells. He learned that Dr. Gold had a contract with a biotechnology company that gave Dr. Gold stocks and financing worth more than $3.5 million to commercially develop and scientifically investigate the cell line. The market value of the cell line was predicted to reach $3 billion. Upon learning of the deception, Moore said that he felt violated for dollars, invaded,